basically, you've just seen how complicated the process of administering veteran care is, and how much Ukraine has to do before the system starts working completely and to its full potential. And in our previous meeting with the NATO working group, we have discussed the possibility of setting up actually a research institute on veteran issues and veteran care in Ukraine, in a similar way in which such institutes operate in the UK and the Netherlands. And we're exploring this opportunity as well, and this will be most helpful to Denis, actually, who just mentioned that we would need 10-20 people working for 2-3 years in order to achieve the best results. So with this in mind, Drew, maybe you can comment on not only, we have spoken a lot about making some processes in administering veteran care automatic, but in order to reach the point where we can go from offline services to online services, we need to do a couple more things. And I think you're the person who can describe that bit about collecting the data necessary to create the online systems.
Well, I'm having flashbacks to my own system here. The complexity of the information is enormous, and when you think about what does the system need to know about the target population, the veterans, in order to help the veterans, it is very complex, and I don't think any system is perfect, just to be clear. The diagrams are very helpful, and working through the process is incredibly important, and it's also very important to be realistic about the timeline. I'll speak to one particular example in the VA in the US. We get data from multiple sources. We've increasingly gone online and gotten data directly from veterans in the US. We get a lot of information transferred to the VA system from the Department of Defense, and that's its own complex story of data gathering and management. But we have a more recent, in our post 9/11 veterans, we have concern in the community about burn pit smoke exposure. When our service members were deployed to Iraq and Afghanistan, the rubbish was disposed of through open burn pits, and a number of veterans now are concerned about health effects of that exposure. In order to understand those concerns better, we didn't have the data. We didn't have samples from, we had some air samples and other information from the theater. But in order to get ahead of this, we really needed to get the information directly from the veterans who were concerned about this. And so the VA and the DoD in combination actually created what we call the Airborne Hazards and Open Burn Pit Exposure. And it was the first, what we call registry around a particular health concern or condition in the VA that was online. And so for that, it was kind of groundbreaking. I was involved in the process of setting it up, and it was under our Congress set a mandate and said, you will have this up and running within 1 year of funding, and we came very close. We were up and running within about 18 months, and it was very expensive. It was very labor intensive, and it was somewhat controversial in terms of how it was implemented. There were a lot of stakeholders. There was the VA, there was the Department of Defense with all of their components, different branches of the military, different components of the military. We had our veteran stakeholders and audience, or advocates, who were very interested in what was going to be asked and how the information was going to be used. We had local providers who were very interested in how is my veteran going to participate in this registry, and what am I going to be expected to do to help my veteran once they've participated in this registry. At the end of the day, what we have is an online website also a mobile application that's available to complete the registry. It is linked with DoD data, Department of Defense data. In order to be eligible for the registry, you actually have to have a particular type of password and identification code from the Department of Defense. And then once you're determined to be eligible, and as we've discussed previously, there are certain groups who are eligible, certain groups who are not eligible. Once you're determined to be eligible, you can go through and complete this questionnaire online, and it's fairly straightforward once you're in there and clicking on the boxes. It's lengthy, it takes about 40 minutes, and so you have to be, it's not a mandatory questionnaire or a registry, and so you have to be very motivated in order to actually get through all that information. But, and this is where it gets a little exciting. So this is the first time that it's been this easy for our veterans to actually respond to these sorts of questions and provide this information. And so in less than 4 years, we've had more than 130,000 veterans participate in this registry and submit this information. And now we're at the point of being able to analyze the information and make some sense out of what we're seeing, what we're hearing from the veterans through this modality. Just as importantly, because it's a voluntary registry, there are lots of limitations with regard to research, but it's been very good at improving our abilities to reach out to veterans with this particular concern, to share information about burn pit smoke exposure and other exposure concerns. And we have been able to do some analyses of the data itself and publish some articles and publish summaries of those articles that are then distributed directly to veterans. And finally, we're able to merge the information from the registry with our electronic medical record information. And so we're actually able to compare kind of the self-report of the veteran and their self-report of their exposures with diseases as documented by the healthcare provider in the system, test results, patterns of utilization, and so as we get more information about the healthcare that's being provided and the evaluations that are being done, we're going to be able to answer more questions. So I think I'm going to stop there. I think that's one example from our system that is of the modern age and demonstrates at least some of the potential for a system of collecting this information.
I just have a quick question, though, from what you've presented. So you use this this data which you collect, and that data then is used to not only provide solutions for the health conditions which the veterans encounter, but also to shape government policies. Is that correct?
Yeah, yes, it is.
In a nutshell. So what if you collect data which the government doesn't want to hear about, or necessarily data which is, politically inconvenient, so to speak? Are there any regulations for or against that? Because I think that's something that when Ukraine is working on its system, it needs to bear in mind as well, how to keep this research and data collection independent.
That's a really great question. So I work as a researcher, and I feel, I guess I didn't take an oath as a researcher to report the truth, the whole truth, and nothing but the truth. But that's kind of the researcher's approach to this, is you're trying to understand the truth, right? But I do work for the federal government. They own the data. They control my functions and as an employee. And so I think if you're outside and you're suspicious of the government, yes, this would be a problem. I do know from the inside, I do not feel stifled by my employer to not report something. But there are steps that need to be taken and reporting processes that need to be followed. And certainly, when I publish a paper of using these data, I let my bosses know that this has been accepted for publication in a peer-reviewed scientific journal. And once it gets that far, it's kind of too late for them to do anything about it, right? So, so I think from my place in the US and where I sit, I don't see that as being a problem once you're looking at the data, but obviously that could be different in different contexts.